June 6th, Dental Insurance Awareness Day. Relying on dental insurance, could it be doing you harm? What problems come to mind when you think about going to the dentist? Do you ever feel like you're being sold something when you go to see the dentist? Do you ever feel like the insurance company is out to take your money? The concept of dental insurance began in the 1950s as a benefit for employers to attract potential new workers. And what was once a nice benefit, is now peanuts. And so employers offer benefits such as dental insurance as a way to lure in employees. When they buy the insurance plan, it's not typically the best plan. It's what they buy that's cost effective so they can offer a benefit. Now, it's also an advantage to the business as it's typically 100% deduction on their taxes. So dental insurance, although it started in the 1950s, became very popular in the 60s, where it paid a maximum benefit of $1,000 to $1,500 per year. Now, you should scratch your head at this point and say, well, wait a minute, that's still what I get today, 60 years later. And that's true. So at the time in the 60s, that amount would have paid for about 3 to 5 dental crowns per year. Very few claims were ever denied, and dental insurance became a traditional employment benefit for most workers. So fast forward 60 years to 2022, the maximum benefit paid today is, yes, you guessed it, an average of $1,000 to $1,500 per year. Yeah, I've seen plans at $2,500 to $3,000, but extremely rare. And usually it's someone that's an executive in a company. So that $1,000 to $1,500 a year, that number's barely ever changed in the face of inflation and the general rise in the cost of delivering healthcare. So $1,500 today may now not even cover 1 crown per year. In addition to this lack of movement in the benefits that are paid out, the contractual policies of the insurance industry have become increasingly limited and hostile to doctors. Much more documentation is required or requested from the dentist and from the patient, to the point that most offices have had to add an additional full-time employee just to handle the increasing paper or electronic workload required to receive increasingly less benefits on behalf of the patient. So you're hiring more and making less. Does that make sense to you as a business owner? Now, if you don't believe me on this, go Google history of dental benefits and see what you find. So, could you be paying more over the years but getting less? I think we've already pointed that out, and you can see it when you go Google this. So, of course, you're getting less. It's obvious, but no one's arguing in your favor. Meanwhile, the insurance company is just getting wealthier. Dental insurance is no longer insurance. It's assistance. It's a coupon at best, and it only exists because it has become a benefit, for many years. Now, the price of gold was 40 cents an ounce back in the 1950s and early 60s. Today, as of March 2022, gold is $2,074.60 per ounce. That's inflation. So has your dental benefit kept up? No, it obviously hasn't. Have your premiums gone up? Yes. Has the dental industry as a whole gone up as far as the cost of rent and materials and employees, etc.? Yes. So you're starting to see a picture here? Inflation just rose this year by over 8%. Did your insurance benefits follow suit? No, of course not. They actually continue to drop each year. Now, you have to wonder if they keep offering less reimbursement to dentists each year, and we have normal inflation each year as a given, the CPI index going up, at some point in the not too distant future, there's going to be a place where the reimbursement from the dental insurance companies is too low for a dentist to survive. So what has to happen then? Do they make up the difference from the subscriber in some way, meaning you, the patient? Insurance companies are continuing to lower the reimbursement to their network dentists. Some of their fees they pay doctors are so low that, for example, a cleaning appointment, insurance payments would not even cover my hygienist's hourly wage. So if you accept insurance, potentially do you have to do an inferior job? Or do you have to hire a less skilled employee that has a lower hourly wage? Or do you have to see more patients and do it in a quicker time manner? And so did you still get a good quality cleaning? And for the same token, a crown, the fillings or anything else, think of a crown. Some of my crowns can cost $800 to $1,600. Just the lab bill is $800 to $1,600. That's not covering my assistant, my materials, my office overhead, etc. Yet I know dentists that are contracted with insurance companies to accept $750 to $850 per crown for the price they can charge as a networked, contracted dentist. And the insurance only pays half of that. So they're going to pay half of the $750 or half of the $850, and the patient has to pay the difference. Now, I couldn't provide a cosmetically appealing product for that price. Hence, we've all seen someone walking around in society, during a conversation maybe where you see this big white chiclet of a tooth, right there in front of you, and you're looking at their smile and their teeth, and you're like, wow. Now, if you can see my dental work during a conversation, then in my mind, I've done something wrong. I haven't done my dentistry well enough. But that's the caliber of dentistry that you might get from your insurance company as compared to maybe someone that's providing a better quality of service. There's different types of services. Not to say it's bad, it's still Crown, it may work, but that may not be what you want. So here's some facts. Look at these images from the ADA, American Dental Association. It shows the decrease in insurance company reimbursement from the years 2010 to 2015 in virtually every state, accounting for 99% of dentists, and only 4 states had increases. Now, network dentists, contracted dentists, they're typically afraid to drop their contracts for the dental insurance companies for fear of losing patients, losing their income. Hence, this fear, this paralysis that the dental insurance companies know of, it allows them to continue lowering reimbursement because they know that dentists are too afraid to no longer be contracted with the insurance companies. So next, look at the growth in the dental industry over a 15-year time period. Look at this slide. From 1990 to 2015, the industry grew by 70%, while general dentists, their income remained flat. The annual cost of living continues to rise every year. So in essence, if the dentist is making the same money over 15 years, they're actually going backwards every year. Do you think that might cause some dentists to get creative in their billing or their diagnosis based on the continued decrease in reimbursement from insurance companies? Remember, the insurance company sets the fee structure in dental offices when a dental office is under contract with that insurance company. The dentist can't change their fees. Okay? So if a dentist is getting paid less every year and having to work harder to make less, something has to give or change. So it could be quality of materials, quality of work, finding extra work, or maybe being more aggressive in their diagnosis, sometimes even overbilling the insurance companies or coding differently. So let's talk about some other aspects. What about your health? Is your health important to you? When you think of dental insurance offering typically 2 cleanings a year that they're going to pay for or allow, so are they determining your health? And how are they determining that? How do they know how much cleaning you need and how frequent and how often? They don't. They're just offering a benefit. Their benefit pays twice a year. And if you're relying on them for your health, you may be having more problems in your future. They don't have your health and your well-being in the best interest. You may be actually harming yourself by following their guidelines or listening to them, as they just want to keep your money. They want to offer you 2 cleanings a year, and that's not based on any research either. They just want to offer 2 cleanings a year. The 2 cleaning a year thing came back in the late 1920s, early 1930s, based on a toothpaste ad, a Pepsodent toothpaste. They stated that using Pepsodent twice a day and seeing your dentist twice a year, that would make you healthy. This wasn't based on any research. This was the first time, that toothpaste actually had been invented and utilized. Prior to that, it was dental powder. So the goal of the ad campaign was to sell more of their toothpaste and for dentists to advocate the selling of the Pepsodent toothpaste. So hence, the more often you go into the dental office, the more opportunity to sell toothpaste, and the dentist gets to provide treatment and gain revenue. So it wasn't based on research as far as why we said twice a year cleanings. But yet that's been carried over in the insurance company for all these years. We now know through current research that irreversible damage can happen to gums and bone in your mouth in as little as 90 days. Hence some patients need to be seen every 3 to 4 months until things get taken care of, and then they can go back to maybe twice a year cleanings. But insurance isn't interested in helping you. They have rules in place to maintain profits and to not pay any more than 2 cleanings a year. Well, that's going to take away from revenue and profits for the shareholders. It's for the same reason patients that have dental insurance don't understand how they're paying higher premiums each year, but getting less and less covered due to the insurance company not raising the annual reimbursement for the patient. But the patient oftentimes has no clue how bad it is for most dentists, right? You just assume, well, it's free, it must be good. Free's not necessarily good, right? It's also possible that patients may be getting an inferior service due to the reimbursements being so low to the dental office that the dental office can't be profitable to render quality materials and services. Now, is that being disclosed to you so you can make an educated decision on your health when treatment's being rendered? Dental insurance is not something that is trying to help you. It's a business. Their job is to make money. They make it by you not using your insurance benefits or by denying you services, hoping you won't go back and debate it, and to continue paying out less and less to dentists to keep their profits as high as possible. Now, if you know this, use it for what it is. Dental insurance is a coupon discount. It's a rebate. Don't rely on them for advice on your health care or to cover your dental services. Consider it as a wonderful discount benefit, but don't rely on them. Obviously, dental care is not cheap, and insurance companies are going to push you to go to an in-network contracted dentist with a claim of it saving you money. But in reality, they know they'll keep more money, making them more profitable. And as a patient, in reality, you might pay more financially and or have more work done than necessary. And how does that play out over the rest of your life? So keep in mind, if you pay for cheap, you often get cheap. You can't provide a quality product in less time and at a lower price point. Your health is the most important thing you have in this world. Make your health a priority, and don't let anyone mislead you or take that away from you.